Ottawa's top doctor is asking residents to be COVID precautious as the city sees a rise in COVID-19 infections. As of Tuesday, November 9, Ottawa has 21 active outbreaks of the virus, each with under 20 cases, except for one in a shelter, which has been associated with 35 resident cases and 4 staff cases. The city does have a high vaccination rate, but more contagious variants of COVID are changing the playing field. Etches says an increasing number of cases could be associated with a slight rise in hospitalizations and deaths, which could impact the more vulnerable population. A rise in cases is expected as the winter months grow closer and gatherings are being moved indoors. Speaking at a virtual press conference on Wednesday, Etches talked about what indicators they are looking for.
What we're watching for is the rise in not only the number of people testing positive for COVID, but if it starts to touch hospitalizations and the number of people getting severe illness. We have had a bit of an increase in hospitalizations, but we also have hospital outbreaks right now that's contributing to the hospital numbers with mild infections. In fact, some of the people being counted as hospitalizations right now are actually asymptomatic. They're in hospital for other reasons.
As gatherings move indoors, Etches is encouraging Ottawa residents to think about wearing a mask, even when fully vaccinated. She also says smaller is always better when it comes to crowd sizes, and those who are immunocompromised should think about staying away if possible. Etches says if everyone moves forward with a little more caution, we can keep numbers down, a step made even more important by the upcoming Christmas holidays.
We just need to do a little more in terms of being cautious with the way we wear our masks, wearing our masks indoors, being careful when we're in crowds where people may not be vaccinated.
The Ottawa Senators are also dealing with a COVID-19 outbreak. The team was forced to cancel their morning skate Wednesday and shut down the Canadian Tire Centre after 8 players and 1 coach were placed under COVID-19 protocol. With the virus now spreading in various settings, there are calls to scale back capacity limits in certain venues, such as at sports facilities, arenas, restaurants, and gyms, which can now all operate at 100% capacity. Some say the government moved too quickly with reopening and are now paying the price. Ontario's top doctor, Kieran Moore, says he feels it's unlikely restrictions will be added, saying they are strictly looking at putting a pause on further reopening plans. On Wednesday, he announced the remaining settings, which are under capacity limits, would not move forward for at least 28 days out of an abundance of caution.
At a provincial level, I honestly don't see us stepping backwards. It's always been my advice to government that if we have to, we'll pause, but we won't take steps backwards. So I want Ontarians to hear my commitment that we'll keep our schools, our elementary schools open, our colleges, universities, secondary schools open, that we won't take a step backwards. We may have to, at a regional level, as we're doing and have worked with Sudbury District Health Unit to do, as we've done previously with Waterloo District and Porcupine District, when rates have gone too high too quickly. And if they need extra capacity for case and contact management, we have provincial resources to bring to bear.
And the rate of new daily COVID-19 infections here within the city of Ottawa is rising. At this time last week, it was at 26. Now it's at 35. Ottawa's top doctor, Vera Etches, says maskless gatherings are partly to blame. Charlie Cenac, UIN News, Ottawa.